Hi, it's Dr. Miller. I'm here with John, and I want to demonstrate the best way to take care of your nose after your surgery. Now, right when you're done, you'll be going home, and we want you to put ice on your nose. And the easiest way to do it is a Ziploc bag. Take a Ziploc bag and put some ice cubes in it, or crushed ice. Alternatively, you can always take a glove like this, put ice in it, and then just tie it off at the end and use these little fingers like that, and they go on either side of the cast. They work beautifully right there. The other thing you'll have, right after the surgery, you'll be going home with a bandage on the bottom of your nose, and you'll want to create that yourself, or if you want to change it when you go home, here's how to do it. We'll be giving you some of these gauze, and you simply fold it over once, and then fold it over a second time. Okay? And when you do that, it forms a little triangle, and you can just put it right here on the bottom of your nose. Okay? And we'll give you some tape as well. So the tape is taken, and you put the tape right here, like that. And then that just goes on right like this. And then this goes straight on top of the nose. The reason we do this is that after the surgery, you may have some blood coming out of the nostrils. And rather than you constantly having to touch your nostrils, because it can be irritating, it's easier to just have this gather and collect the blood. If you're changing it every 2 minutes, it's a problem. But if it gathers some blood and then you have to change it every hour or so, that's fine. It typically stops within 24 hours. So, how do we clean the nose? That's the most important thing, because in a week, you'll be coming back and you'll be seeing Kelly. Say hi.
Hi.
And Kelly will be taking your cast off, and it's a lot easier for you and for Kelly if things are kept nice and clean and debris free. So here's how it's done, very simply. You'll have hydrogen peroxide at home. Make sure you buy that beforehand. You'll have a Q-tip. It doesn't have to look like this. It can be the typical ones that you get out of a store, but you want to just put it in the hydrogen peroxide until it gets very, 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 very filled with all the hydrogen peroxide. Then you'll take the Q-tip and you'll gently put it inside the nostril like this. Now, it's not so much that the Q-tip itself is pulling out any debris as much as the peroxide itself is dissolving any clot or any debris. Once that's done, after it's nice and cleaned, then you want to cover it with some bacitracin. So you put a little bacitracin right on the end of the Q-tip, and it may be bacitracin, it may be something called Bactroban, which is a brand name for mucoparacin, and this simply goes inside the nostril, and you'll just bathe it with a little bit of bacitracin or Bactroban, and you're done. You can do this 2 or 3 times a day. If you have incisions on the outside here, you can do that as well. Same technique on the outside here and here. And that's a way to take care of your nose.